Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Diabetes Self-Management, Lesser Known Factors Impacting Blood Glucose Levels, presented by Desiree Mehrabian, Certified Diabetes Care and Education Specialist with the Washington Hospital Diabetes Education Program. And now, please welcome Desiree Mehrabian.
Hi, and thank you for being here today. I work in the Outpatient Diabetes Education Program here at Washington Hospital, where we see type 1, type 2 patients, as well as gestational patients, women who are pregnant who have diabetes. For our type 2 patients, we have a class series that they can take. And a lot of times at the beginning of class, we have them introduce themselves and ask them what they hope to learn out of attending our classes. And most people say, I just want to learn what I can eat. But we do know that there are other factors that impact our blood sugars, and that's why I chose this topic to discuss today with you all. So how many of you are frustrated about your blood sugars readings? You might be eating the same thing, you might be having the same breakfast every day, and you're getting different numbers though, and you don't understand why. Or do you wake up with different numbers with higher readings sometimes, and you don't really know why? So first we're going to talk about insulin resistance, insulin and glucose action, and insulin resistance, so you can understand kind of what's happening at the cell surface, and then get into how this influences other factors. So our cell membranes are made up of this two layers of phospholipids, and there are some cholesterol and proteins embedded into the blanket. So these channel proteins are where insulin attaches. So you can see on the slide, on the left side, there is a normal occurring cell where this blue ball here is insulin, and it's attaching to the cell surface, and it's allowing the glucose to go in. So after you eat carbohydrate foods, they turn into glucose. And the purpose of the glucose is to give our cells energy. So, the glucose comes in normally. But when there's diabetes going on, some insulin resistance, or even prediabetes, the insulin doesn't quite attach correctly, and so the glucose isn't able to go in. So we call this insulin resistance, and all this, some of the glucose goes into the cell, but not all of it. So some of it stays in the bloodstream, and it cannot enter the cell to provide energy. So some glucose goes inside the cell, and some doesn't. So, so you can kind of envision it like the snow piling up to the door, and you can't open the door either way. You're unable to allow the glucose to come inside the cell. So maybe you're finding this out yourselves, and you're realizing that other things are impacting your blood sugars besides food, and you may realize that your emotions can impact your blood sugar. So there's hormones involved in this process, also, which are part of the insulin resistance. And also, this is the fight or flight response, where there's more glucose in our bloodstream and there's less insulin that's working properly to help that glucose come out of the bloodstream and go inside the cells. So the only problem is with the fight or flight response, there's more glucose being mobilized into our bloodstream, but there's no chasing going on, and so we're not able to use up that glucose, so it stays around in the bloodstream, and there's less insulin secreted during the fight or flight response. So we have several hormones involved in the fight or flight response, and which happens when we're stressed. So stress in general, our body perceives any physical stress or emotional stress to release these stress hormones. And so, for example, physical stress can be having a serious illness or an infection. And emotional stress is kind of like what we go through almost every day of some sort. So insulin levels go down as the more blood glucose stays in the blood. And so this all happens because of epinephrine, which is also called adrenaline in normal talk. And it puts more glucose into the bloodstream from our livers. Cortisol is another hormone that keeps less insulin from being secreted during fight or flight. And also growth hormone counteracts the insulin effects and breaks down fat, causing insulin resistance. So during stress situations, you may need to have more medication to help control the blood sugar rises. Another thing that can happen, let me just go back. Another thing that can happen if somebody is having a low blood sugar from having too much medication or insulin, the body can rebound, and the glucagon is rapidly secreted. So the person can end up having high blood sugars after that. So they can have a low blood sugar and then it can go up. So we call that a rebound action, and those can last for 6 to 8 hours, and we call those like a roller coaster day. So you want to get into a rest and digest mode to avoid the chronic stress and having the sympathetic hormones released. So sympathetic is kind of an odd word. I remember it as not being sympathetic at all. This is happening when we are really stressed. So we want to reduce the cortisol being secreted, and we want to use up our glucose to improve our insulin sensitivity. So you may want to find some coping mechanisms that work for you, such as getting enough sleep, staying in contact with your friends and family. Maybe you need to do some medication, exercise, have some time for yourselves in the day, doing hobbies that you like to do, and then do other things you like to do. So you want to try and relax. So the next topic that impacts blood sugars is sleep deprivation. So over the last few decades, actually, people are sleeping less in general. And it can cause abnormal blood glucose levels, which leads to insulin resistance, which leads to type 2 diabetes. So people are sleeping fewer hours, and which can cause weight gain and from the insulin resistance. So, and a lot of that is from the cortisol that we just talked about being secreted. Also the growth hormone, the glucose levels increase during sleep, and it can also cause some inflammation going on in your system. Also, studies can show that when people have diabetes already or prediabetes, having higher blood glucose levels can experience poor sleep. Disordered breathing and sleep apnea can increase blood glucose levels. Poor sleep is also associated with reduced ability to control glucose levels in people with diabetes. And also, for example, like when people are in the hospital, they lose a lot of sleep, and that can cause their blood sugars to go up. And also, another thing that can happen with some people is they can get low blood sugars. Maybe they took too much insulin, or they didn't eat enough in the evening, or were too active. And they may wake up during the night having nightmares, crying during their sleep, sweating profusely, feeling irritable when they wake up. So those are things to be aware of in general. So we want to get enough sleep in our lives, about 7 hours a night, because the sleep is restorative. And our sleep and our physical health are closely connected. So that also, we want to get enough sleep to keep our blood blood glucose levels more normal, and avoid unhealthy blood glucose levels, and also sleep also lowers our blood pressure and our heart rates, which we need to do as well. Okay, another thing that can happen is around 4 to 8 a.m. Normally our blood glucose levels rise, and normally enough insulin comes out of the pancreas to bring down those blood sugars. But in type 2 diabetes, the insulin secretion or the oral medications that people are taking are not compensating for the rise. So someone will wake up with the blood sugar higher than when they went to bed and not really understand what's going on. And it has to do with the insulin dysfunction. It's not working properly. It comes out too slowly, or there isn't enough insulin. So this can be treated by having less carbs in the evening, being more active in the evening, and having a breakfast to break that fasting that's happening. All right, now we're going to talk about food finally a little bit. It's easy to get off track with carb counting when you're on vacation or you're eating out. For example, it can be difficult to estimate the carbs. Maybe at home you have your plates and you have certain foods you eat, but when you go out, it's a different story. So there are a few apps that can help you maybe when you're sitting at a restaurant. One is called Calorie King. It has a large database, and you can look up restaurant chains, and maybe you're at a restaurant that's not in there, but you could maybe find a chain restaurant that has comparable meals to the place you're at and find the carb counts, and also look up sodium and fat levels as well. There's another one called FigWee, and that one shows food that's on a plate, and you can change the serving sizes of the plate, and then it will give you the nutritional label that corresponds with the food that's on that plate. You can also use some visual prompts. You can use your hand or your fist, although these are crude estimates. So a woman's hand is going to be smaller than a man's hand, which means that she needs less of the foods. So 1 cup is the size of your fist, which is comparable to maybe amount of rice you want to eat, or some cooked vegetables. Or you may just want half a cup of rice, which would be half of your fist. And then a quarter cup is about the size of an egg. I was going to bring an egg. I don't have it with me, but an egg is about a quarter cup, which is about the amount of nuts you would want to eat maybe for a snack. And then your fingers is about 2 tablespoons, which would be about the amount of fats you would want to have, for example, like peanut butter or cheese. But a study was done in January of 2020 that showed that fat affects how quickly our stomachs empty, and it actually slows down the emptying of the stomach. So it impairs glucose sensitivity, which means that it takes longer for the food to digest, and so the glucose levels will be higher until it's all digested. So if someone's having a meal with more than 40 grams of carbs, which is about 2.5 portions, you want to calculate the carbs that are needed for that meal, plus add 20 to 30% more to account for the fat for the insulin, if someone's taking insulin, for example. And if someone's using a pump, they can use the dual wave or the split wave functions, which prolong the secretion of the insulin from the pump. So high-fat meals are what's on this slide. We have this double cheeseburger with the cheese and the fries next door to it. There's the fried rice, Panda Express fried rice, and then this pizza. So those would be example of high-fat meals. So what do you do about all of this? So you can, as I said, you could look up the menus ahead of time to make some healthy choices before you go to the restaurant. You can substitute some non-starchy vegetables for the potatoes or other starches or fats that might come with the food. You can ask for the substitutes, or you could share a meal with someone and also have appetizers or a dessert with that. So that would be some ways to handle those kind of situations. Next, we're going to talk about exercise. So some people occasionally will say, I thought exercise is supposed to lower my blood sugar, but I do these, sometimes, I do these certain things and I find that my blood sugar goes up. So yes, of course, we want people to exercise. It improves insulin sensitivity. It lowers blood glucose levels, in addition to reducing other health risks. And overall, exercise enhances our mood, which we want, right? We want to have a good quality of life. But sometimes the blood sugars will go up when someone is doing high-intensity exercises. For example, heavy weight lifting, doing sprints, or doing some competitive sports which cause increase of adrenaline. And we know that adrenaline is part of the whole stress response, and it stimulates more glucose to be secreted into the bloodstream. So that would cause the blood sugars to go up after an intense exercise session. Also, what can happen if somebody has too many carbs before the workout, before the exercise session, it may not be enough. The exercise itself may not be enough to keep the blood sugars in normal range. So if you want to avoid this rise in your blood sugars, you want to choose to do moderate intensity exercises. That would be more like aerobic workout, using light weights or circuit training, which it would be more repetitive. And also you want to try and have some relaxation techniques, take deep breaths, do whatever you need to do to minimize the adrenaline effect. Another thing you could do is consider exercising later in the day, so you're avoiding the dawn phenomenon that we talked about earlier. Let's see, if you take insulin or medication, you can ask the doctor to adjust your doses for you. And if you are, maybe you're playing a game and you have a halftime, instead of having excessive carbs, during that workout, you would want to try a more protein and fat-based snack, like yogurt and nuts or peanut butter, instead of a high-carb snack in between. So you may want to keep an exercise log where you write down what you're doing and what kind of blood sugars you're getting, and see if you need to make some adjustments. Okay. Next topic is medications. So there are some medications that can raise your blood sugar, and so whenever your doctor prescribes a new medication for you, you want to ask your doctor, how is this medication going to affect my blood sugar and my diabetes? You want to make sure you know what the medications are for that you're taking, and you may need to check your blood sugar more often when you're on these medications. So some medications raise your blood sugar, such as steroids, prednisone or cortisone, which are used to treat inflammation like arthritis, allergies, those kind of things. Birth control pills can increase insulin resistance, which would lead to increased blood sugars. Anxiety or ADHD medications can raise blood sugars. Then we have blood pressure medications, beta blockers. There's different types of blood pressure medications, but beta blockers and thiazide diuretics can increase the blood sugars. So that would be like Lopressor, Tenormin, Corguard, Inderal, hydrochlorothiazide. If anyone's taking any asthma medications, high doses of them, or injectable asthma medicines, or any retinoids for treating acne. There's also some over-the-counter medications and some decongestants and cough syrups. So you may want to ask your doctor if you should take sugar-free cough syrup or the regular kind. And again, you want to ask your doctor, and whenever they prescribe a new medicine for you, if it's going to affect your blood sugar, and maybe your dosages need to be adjusted. All right, next we're going to talk about alcohol. So alcohol is rather interesting to understand what it's doing in your system. Alcohol goes through our system, and when it gets to our liver detoxifies the alcohol and breaks it down so the kidney can flush it away. The liver detoxifies toxins, obviously. But it also, our liver also releases stored glucose, but it can't do both of these at the same time very well. So it usually chooses to detoxify the alcohol. So that means that as it's breaking down this alcohol, you're not getting the extra glucose being secreted by your liver. So this can cause your blood sugars to go down, especially if you've exercised before you drank, and if you're not eating while you're drinking. And this can last for a long time afterwards, even when you go to bed, or even the next morning, you may notice that your blood sugars are lower. And if someone's taking some diabetes medications, like insulin or sulfonylurea, they can get low overnight. So it's good to know what the symptoms of low blood sugars are. And I put a slide up there to show what they are. So they're sweating, cold and clammy, we say, shaky, someone's anxious, they start acting kind of confused, or their behavior changes. So those are some symptoms. Maybe you might be with someone who might be experiencing this. So it's good to know what it could be. And if someone needs to, they should bring some snacks with them. And if you noticed in this picture of the pretzel snacks, I included some nuts in there too to prolong the effect of the carbs so the person won't go low. So there is this organization, it's called Take Control of Your Diabetes. And these two gentlemen here are both type 1, they're both endocrinologists who have type 1 diabetes. And they run this program, Take Control of Your Diabetes. It's an organization, and they do conferences around the country, and they also, during COVID, they started doing more videos online. So on YouTube, they have a lot of their videos, and one is called Alcohol and Do Diabetes Mix? Do They Mix? So I put it up here because I think it would be interesting if someone's interested to watch this video. And there is the link for it, and it's also in the resource page that's at the end of the presentation. The younger guy, Dr. Jeremy Pettis, drinks beer, and Dr. Edelman, the older doctor, is drinking straight alcohol, whatever it is that he's drinking, whiskey or bourbon or something. And they both are wearing continuous glucose monitors during this 3 hours that they're doing this video, and so you can see the difference between drinking beer and drinking straight alcohol. And I'm not going to tell you what happens. I would like you to watch it because it's rather interesting. All right, next we are going to talk about what happens to women. So the men are not excused from this, because you may have a woman in your life, either your wife or spouse or partner, or you should understand what women go through with their hormones. So in general, when women have their periods, they're still, they haven't reached menopause yet. The estrogen and progesterone levels affect the insulin sensitivity. So just before the period starts, about 3 to 5 days ahead, these levels peak of these hormones, and they can cause insulin resistance. So someone may notice not only the PMS problems of grumpiness and eating too much, but also the blood sugar levels go up for some people. So it may help if the woman isn't doing it yet, to start tracking the start dates of their periods, so they can determine ahead of time if they're having these increases in the blood sugars, if it's from their hormones that we're talking about, the estrogen and progesterone, or are they inaccurately counting the carbs. So that would be important to do that. And also your care plan, you may need to be modified during that time. For example, if someone's on insulin, they need to increase the basal insulins for about 10 to 20% to compensate for any increased fastings, or increase their mealtime insulin to cover the food they're eating, the increased insulin resistance. Some women may see a decrease in their blood sugars for the first couple days of their periods and then an increase in the days 3 to 5. So that would be another reason to track the dates of what's going on. And sometimes also women have irregular periods, or they're unpredictable, they're more frequent, or they're longer. So that's would be a time to ask your doctor about those situations. All right, our last topic is going to be the next thing after menstrual periods. Then we get to menopause. And during menopause, estrogen levels go down, and you can see that on the lower slide there. Estrogen levels decrease around 45 to 55 years old. And estrogen is an important hormone. It's been proven to optimize insulin action. And so when you're not going to have the estrogen, it will cause the body to change. So you can see in the top slide, the estrogen decrease contributes to belly fat and obesity. So some of you may have experienced this. And it also increases risks for type 2 diabetes because of the increased insulin resistance. And also, as people get older, they tend to be less active, which causes weight gain as well. So in addition to weight gain in type 2 diabetes, there's also risk for cardiovascular diseases. And so if someone already has type 2 diabetes, they may need more medication or insulin to avoid the fluctuations, which can cause health problems. So that's for someone who's already taking diabetes medications to help lower their blood sugars. Also, estrogen deficiency can cause some inflammation and cause increased resistance, which makes it difficult to lose weight. So some women may have noticed that as they get older, besides decreased metabolism, there's all this increased insulin resistance going on. So I call it the battle of the bulge. So since we talked about insulin resistance at the beginning, we need to talk about insulin sensitivity, making ourselves more sensitive to insulin, and how to do this. So you can see from these pictures, the top one is about food. We want to eat more fiber, protein, and vegetables, and kind of displace some of the carbs we would be eating. You want to avoid refined and processed carbs, so that would be like processed foods, cereals, especially the sweetened cereals. They're really processed where the grains are like flakes or puffed rice or those kind of things. Avoid white rice, white bread, foods that have added sugar in them like sodas, and also pastas, because they're usually made with white flour. And these refined carbs have no fiber in them, and they've lost a lot of their vitamins and minerals. And they digest really quickly, which cause the blood sugars to go up. So that's why you want to avoid them. You also want to reduce your red meat intake, because red meat tends to have higher fat, which causes inflammation, and we discussed causes insulin resistance, and which makes weight control difficult. So you want to reduce red meat intake. You want to make sure you're exercising probably more. Even as you get older, you want to exercise more to keep your cells sensitive to your own insulin and keep your own insulin working better. And again, we talked about sleep and stress, so you want to get enough sleep and reduce stress. Those two things will improve your insulin sensitivity. All right, thank you for your attention. The last page is, this was a Word document, but these are the references, the sources I used for my presentation. I would really like you to check these out, especially if any of these topics were interesting for you. And if you or a loved one you feel needs more support for caring for their diabetes, please have them referred to our program. Thank you.
Great, thank you, Desiree. We do have a few questions.
Okay.
The first question is, I like to have a snack before bed, but my blood sugar is high in the morning. What is a good snack to eat to keep my blood sugar in range?
So we talked about having lower carb snacks the night before. So something that would be more like a fat-free Greek yogurt or peanut butter and a few crackers. Those kind of things would be helpful to have. Cheese and crackers, or maybe some cottage cheese with some nuts. Nuts are another thing to have before bed.
Great. And the next question is, should I exercise before or after I eat?
Well, that is something that you need to find out on your own. So a lot of, we call diabetes, our program that's recognized by the ADA is called Diabetes Self-Management and Training. So we teach you how to take care of yourself. So that means that you'll probably need to do some more monitoring of your blood sugars and do some trial and error as far as exercising. And because you also have to consider the medications you're taking, what you're eating, when you're eating. Like, you have to think about the prior meal and if your blood sugar came back to normal from there. So that would answer a lot of questions your own questions pertaining to whether you should exercise before or after a meal.
Okay, and then we'll move on to the next and last question, which is, what is a good source of plant-based protein?
Well, it's coincidental that you asked me this question, because I was looking at this morning, and I, in general, the main ones are beans and lentils, tofu-based or soy-based products like tofu, edamames. Those have a lot as well. But there's also some grains that have a lot of protein in them, like amaranth and quinoa and teff flour or teff, and also the chia seeds and hemp seeds, which are kind of trendy right now. So those are all good sources of protein that come from plants.
Okay, well, thank you very much for answering all the questions. And this concludes our program. Thank you, Desiree, for this insightful presentation, and thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.